Attending's going to be here in a minute. Did you see the new one? Someone see the new one?
Yeah, I saw her.
Okay. Why don't you give me the quick and dirty on the new one, and then we'll just go from there. Okay?
So I saw Miss Jones this morning. She came in last night. She's a 59-year-old lady. She came in because her left leg is swollen, I think. And she says it started a couple days ago. She's not really sure, but she thinks it's getting worse. And it's never happened before. But she has a history of diabetes, so in the ER, they did a Doppler of her leg.
Okay. What did the Doppler show?
So the Doppler was negative, so they started her on some IV antibiotics.
Okay. Do you know what kind of antibiotics?
I think they started her on cefepime.
Did she actually get the cefepime?
I don't know how you tell that. So.
Did she actually get the cefepime? Come on, guys.
Yes, she did.
Okay.
Yeah.
All right.
Yeah.
Fine. Before the attending gets here, why don't we go ahead and talk about the new patient we got? You saw the patient?
Yeah, I saw her.
Okay. Go ahead and start telling me about her.
Okay. So I saw Miss Jones. She's a 59-year-old lady. She came in to the ER, I think, mainly because her left leg was swollen.
Okay.
And she said it's going on for a few days. She's not really sure how long, but she thinks it's getting worse.
Okay.
So that's why she came in. It's never happened before, but she has a history of diabetes, so in the ER.
Why don't you hold off on telling me what they did in the ER and go ahead and give me the rest of the history.
Okay. So she said, when I asked her about her leg, she said it was red and it's a little bit painful too. Her past medical history, she has type 2 diabetes and she has hypertension. She's had for 6 years. And her medication, she's on metformin and glyburide, lisinopril, HCTZ, and aspirin.
Okay.
And she doesn't have any allergies. And as far as her social history, she lives with her sister, and she used to smoke, but she quit 5 years ago.
All right.
She doesn't drink or do any drugs, and she works at a drugstore. So on her exam, her vital signs, she had a fever this morning. Her temp was 102. Her heart rate was 96. Respirations were 16, and her pulse ox was 96. Her exam was pretty much normal, except her left leg was swollen, and it's red, really, I guess, from like just below her knee down to her foot, and it's kind of warm if you touch it.
Okay. All right, so before we go into what all they did in the ER, let's talk about differential diagnosis. What are the top 3 things you think could be going on with her right now?
So I guess cellulitis could be one, and then maybe fasciitis.
Okay.
And then
It could also be a DVT.
Okay.
Or venous insufficiency or small trauma.
That's right. So let's take the history that we have right now and kind of work through some of these. What do you think is going on with her? What's your top?
I mean, I guess it could be cellulitis.
Okay. And what are the physical exam features that we would think about for DVT?
So usually it's one leg that's swollen, and it can be red, and it's usually painful.
Okay. And any other physical exam findings with the DVT that you can have?
I guess you can have fever too.
Okay. And so is there anything in her history that would point towards cellulitis?
Well, she does have a fever, and it is red, so it could be cellulitis.
All right. And so it sounds like cellulitis and DVT can sometimes have very similar physical exam presentations. So what are some elements of her history that could help us kind of differentiate the two?
Well, I forgot to ask her about like DVT risk factors, but you could ask about, travel history or if there's any history of cancer. She doesn't smoke, but she used to, and she's not taking any hormone replacement therapy.
That's right. So we can certainly go back and ask her that this morning on rounds. What about cellulitis? Is there anything in her history that, gives her risk factors for cellulitis?
She's a diabetic. That puts her at a high risk of infection.
Okay, that's right. Absolutely. And also, we need to ask her if she's had any history of minor traumas.
Okay.
because that can sometimes lead to these physical exam findings. So, what do we need to do to differentiate between cellulitis and a DVT? Are there any studies that we could do?
So a CT or MRI, I think, could show us if there's any cellulitis.
That's right.
And then in the ER, they did a Doppler with ultrasound to look for DVT.
Okay, and what were the results of that?
So it was negative.
Okay, good. And so, if the Doppler is negative, do we need to go ahead and get a CT and MRI?
Well, we could, but I guess if it's not a DVT, then we could say that it's probably most likely cellulitis.
That's absolutely right. And so how will we treat her?
I guess we started on IV antibiotics.
Okay. And so what antibiotic have we started her on so far?
So she got started on cefepime.
That's right. And we could also add vancomycin to cover for MRSA and things like that until we know what we're dealing with. But good job.
Thanks.